very clear about what just happened in this hearing. Senator Patty Murray confronted the Surgeon General nominee over past comments calling birth control pills a disrespect of life and suggesting Americans use them. Like candy, that's not subtle language. That's not neutral medical framing. That's ideological rhetoric. And Murray did what needed to be done. She brought it back to facts. There are 18 FDA-approved contraceptive methods in the United States, hormonal and non-hormonal, backed by decades of clinical research, evaluated for safety and effectiveness by the U.S. Food and Drug Administration after rigorous review. So Murray asked the most important question of the hearing. Should women trust the FDA or should they trust you? That's not a political question. That's a public health question.
Senator Murray.
Thank you, Mr. Chairman. Thank you, Dr. Means, for being here. Let me start with this. You called birth control pills, and I'm going to quote, a disrespect of life, and you said Americans, quote, use birth control pills like candy. You also claimed, contrary to established science, that hormonal birth control has, quote, horrifying health risks for women. Now, here are the facts. There are 18 FDA-approved contraceptive methods, both hormonal and non-hormonal, and there are decades of evidence showing that every one of these birth control methods is safe and effective. So I wanted to ask you, help me understand, should women trust the FDA, which approved all 18 methods of birth control after a very rigorous look at the evidence, or should they trust your statement that there are horrifying health risks to birth control, which contradicts that evidence?
Thank you, Senator Murray, for your question. I'm curious if you're aware of what the side effects of hormonal contraception are.
I'm curious if you are with the FDA that went through all of these and rigorously looked at them, or as Surgeon General, if you're going to tell the truth to the American people.
I absolutely believe these medications should be accessible to all women. And also, all medications have risks and benefits, and in our current medical climate, with the burden on doctors, doctors do not have enough time for a thorough informed consent conversation. Some of the horrifying side effects of birth control that I have mentioned include blood clots and stroke risk in women who have clotting disorders, who are smokers, who have obesity. No, it's not general. I'm very careful with my words, and when I say those comments, which are taken out of context, I'm speaking about particular women that can be hurt if there is not informed consent about their medical history, their lifestyle exposures, and their family history. I want those women, and I know you do too, to be able to have a thorough conversation with their doctor and know whether they are at higher risk for side effects when prescribed the medication.
Saying that is one thing, but saying on different shows that birth control pills are a disrespect of life is very different.
I am passionate about women's health, and I think it is disrespectful
that people
to
use
women.
Birth controls like candy is very different than what you just said.
We prescribe a huge amount of hormonal contraceptive, and I do not believe most of those conversations have informed consent because of the pressures that doctors are under because of our broken healthcare system. I want what's best for women, as do you, and I want every woman who could be at risk for a side effect
left, and I have other questions. Let me move on. Thank you.
If a woman died from a stroke or a blood clot because they did not have a thorough conversation.
Thank you for your answer. You made that clear. Let me go to another question. Tracy Beth Hogue, she's an anti-vaccine skeptic. She was elevated by the Trump administration to serve as the top drug regulator at FDA. She made comments last week casting doubt on the safety of RSV vaccines for baby. As you sure know, RSV can be deadly even for healthy full-term infants. Do you believe that Dr. Hogue is wrong to question the safety of RSV vaccines?
I have not read that article or seen that quote. I would need to know what she said before I commented on that.
Well, you do know that RSV is the leading cause of hospitalization for infants.
I have a 17-week-old, and I'm very aware of that.
You hear her statement. As Surgeon General, would you contradict it?
I certainly have absolutely no issue having very frank conversations with anyone in the administration if I believe that their statements are misguided in some way or not fully informed. That's not a conversation I would have publicly first. I would have a private and direct conversation with anyone in the administration if I felt that patients were at risk because of.
All right, and I also want to ask you about maternal health. Mental health conditions are the leading cause of maternal death in the U.S., including suicide and overdose deaths. In her comments last week, Dr. Hogue, same woman, also expressed concern about the safety of the antidepressants during pregnancy. Specifically, she called out SSRIs, the most commonly prescribed type. Do you believe that SSRIs are dangerous for pregnant women?
I don't want to be a broken record here, but I do believe that every medication has risks and benefits, and you need to have a nuanced conversation with your doctor before starting a medication. that is, I think, the most responsible position for any doctor to share.
Well, strong evidence has shown that SSRIs are safe in pregnancy. Most do not increase the risk of birth defects.
Certainly.
But untreated
Certainly.
depression in pregnancy puts women at risk.
And I agree with you, but I still think I don't think it's responsible to make a blatant statement for all Americans.
Okay, well, if confirmed as Surgeon General, it will be your job to give accurate and up-to-date health information to the American people. I assume you will take that responsibility seriously.
I absolutely do. And I also believe that the American people are looking for a more nuanced conversation about health. And I believe that will help restore trust in public health.
Thank you.
Now, the nominee pivoted to something we often hear in these conversations. All medications have risks and benefits. That's true. Of course it's true. Every medication carries potential side effects. But here's the difference. There's a massive gap between acknowledging rare risks for specific high-risk patients and publicly framing birth control as something broadly horrifying or morally suspect. When you use phrases like disrespect of life, you're not just discussing blood clot risk in smokers over 35, you're signaling a worldview. And that worldview matters when you're being considered for Surgeon General, the top public health communicator in America. Because this isn't just about contraception. The questioning moved to RSV vaccines for infants, where another Trump-aligned health official had cast doubt on safety. RSV is one of the leading causes of infant hospitalization in the United States. Murray asked directly, would you contradict misinformation if it put patients at risk? The answer? Essentially, I'd have a private conversation first. That may sound diplomatic, but the Surgeon General's job isn't quiet diplomacy behind closed doors. It's public clarity. When misinformation spreads about vaccines, silence creates confusion, and confusion erodes trust. Then came maternal mental health. The leading cause of maternal death in the U.S. includes suicide and overdose. Murray cited strong evidence showing that SSRIs, commonly prescribed antidepressants, are generally safe in pregnancy and that untreated depression can be far more dangerous. Again, the nominee leaned on nuance. And let's talk about that word for a second. Nuance is important in medicine. Absolutely. Individualized care matters. Informed consent matters. But nuance cannot become a shield for undermining established science. When overwhelming medical consensus supports the safety of FDA-approved birth control, when pediatric data supports RSV vaccination, when decades of research guide antidepressant use in pregnancy. The Surgeon General's responsibility is not to introduce doubt where evidence is strong. It's to reinforce evidence. And this is where the larger concern comes in. Public trust in health institutions has already been strained over the past several years. The country has lived through a pandemic, vaccine misinformation, political interference in health agencies, and a flood of online conspiracy theories. So the question isn't just whether this nominee believes in nuance. The question is whether she will clearly defend evidence-based medicine, even when it conflicts with ideological narratives within her own political coalition. Because words matter. When a nominee says birth control is a disrespect of life, that's not just a medical statement, it echoes the language used in broader fights over reproductive rights. And that's why this hearing mattered. Murray wasn't just nitpicking phrasing, she was drawing a line. If you're going to serve as Surgeon General, your job is to give accurate, up-to-date health information to the American people, not reframe settled science through a moral lens. There's a difference between encouraging informed consent and amplifying skepticism. And right now, with maternal mortality high, infant health vulnerable, and misinformation spreading faster than ever, clarity isn't optional. It's essential. This hearing wasn't about scoring political points. It was about something much bigger. Who do Americans trust when it comes to their health? Scientists, regulators, doctors, or political appointees redefining the narrative. That's what's at stake. And that's why this confirmation fight isn't just procedural. It's foundational.